My name's Alanna Maycock and I'm the Refugee Coordinator of a Sydney-based refugee clinic. I've got over 12 years experience in refugee health, both in the UK and Australia. International Health and Medical Services are a private profit-making company that are funded by the government to provide healthcare services on the islands and to a small section of asylum seekers in the community. So they provide healthcare services on Christmas Island, Manus, Nauru, and a section here in Australia. Part of IHMS's contract with the government is that they have to send a paediatrician to the island for 5 days every 3 months. So there's no specialist paediatrician there any other time in the 3 months, just 5 days in every 3-month period. So they've sent various different paediatricians. They asked our team to go, and then when we went in December 2014, we were quite horrified, is a word that I would use, by what we saw there on Nauru. And when you get there, it's a really chilling feeling, and it's really apparent. And you can see the cycle of abuse that has come from the government policy that's keeping them there, right down the chain, and then healthcare workers that have been employed by HMS that are witnessing the abuse and not really doing anything about it, which is what I encountered when I was there. So you've got IHMS that are a private profit-making company that are making over $1 billion a year in a system that the United Nations has said, well, they've been over there a couple of times now, both in 2013 and more recently in 2015, and have explicitly said that they feel that what is happening on Nauru is torture. Now, I went to Nauru with no agenda, literally as a nurse from a refugee clinic here in Sydney, to go and see children and treat children. Not in your wildest dreams do you ever expect to see people physically abused in front of your eyes. And I was only there for 5 days. I can't imagine what is happening to the minds of those that have been there for years. The EU have a ruling of a maximum of 7 days for a child in detention. The average stay for a child in the UK in detention is 5 days. We have an average stay of 15 months here. We signed a contract to say that we wouldn't disclose anything that we saw when we were in Nauru. But we felt that we had a duty of care to these patients. And I've always been trained and taught that if you see anything that affects the health of your patients, then you have a duty to report that and speak about it. My health chain of command wasn't there, and so we felt that we had no alternative but to speak publicly about the conditions and about the things that were affecting the health of these children. Shortly after that, we were asked to go to the Senate, and David and I both spoke at the Senate inquiry, and then we got a phone call to say that the Border Force Act was coming out. This is wrong. You are preventing doctors and nurses and social workers and teachers talking about child abuse, basically. You're preventing us from doing that. And when you look at other countries like the US, you look at the UK, they have laws to protect whistleblowers. We're bringing out laws to put them in jail, to put healthcare workers in jail. And it's a scary time for Australia, I think. And I think what I really want from this is the Australian public to become more aware of the damage that this is doing, and that other countries don't do this. They just do not. There is a better way of doing this. We don't have to lock children up on remote islands behind barbed wire to achieve what they want to achieve.